of people who went against the grain.
It was crucial to their future to be in the classroom.
We're actually safer as a result of being in school.
Courageous Leadership Through Crisis. Live from the Blue Bear Cafe, this is Voices of Courage.
Welcome to Dr. Benjamin and Dr. McGann from Duke
Thank you.
Institute and Duke Department of Pediatrics. Welcome today.
Thank you.
Thank you.
I met these wonderful doctors through the ABC Science Collaborative when we went through a not so pleasant couple of years of a worldwide pandemic. I would say these guys were absolutely essential partners to helping Mount Airy City Schools and all of the schools in North Carolina come back to school safely. I want to thank both of these doctors for being on here and for what I call courageous leadership, partnering with the educators who also were being courageous at the time. I've captured you and several voices from around the country in the Voices of Courage. This is a paper that I hope will inform some leaders who may be facing crisis. I hope not anywhere near the level of a worldwide pandemic, but every crisis can use some of these leadership trends to be effective for students and do what is best for students. So I'm going to start with a couple of questions. You are doctors and experts in infectious disease. Can you tell us why you chose to be involved with education and especially why you stepped up during the worldwide pandemic to help schools? We'll start with Dr. Benjamin.
Sure. So in March of 2020, the National Institute of Health reached out to a few large research groups discreetly around the country and asked us to find ways to help out the public health during the pandemic. And we initially did what was in our wheelhouse, which was describing appropriate and safe dosing of medicines that might be used to treat COVID and to do that for children. In the summer of 2020, the school board from one of the local school boards here reached out to us and they said, gosh, we want metrics. That is the amount of community infections that it's safe to go back to school. And my response to them was, well, actually not enough is known about the disease to really give you, well, it's 100 per 100,000 cases that you should be going back. But what you might want to do is set up an advisory board of some kind that can provide you a medical perspective, an epidemiology perspective, a virology perspective to the questions of whether or not you want to go back to school or the decisions that you make. And we can provide that to you. And of course, we could do that free of charge. There were other groups that were happy to give advice for quite a bit of money. One of the things that separated us was we were willing to do it free of charge. And several superintendents then heard about that volunteer activity, and things just kind of exploded from there.
Dr. McGann?
Yeah, so maybe I can bring it to the personal level. We are all pediatricians. We are most of us were infectious disease physicians. And as pediatricians, we're super invested in children and in their health and their safety. And it became clear pretty quickly that there was lost learning. The more children were out of the classroom, and it was crucial to their future to be in the classroom. And so we wanted to help as much as we could to get them into the classroom safely for the kids, safely for the teachers and staff. I mean, I always think of it, children are our future generation. And we want to do whatever we can to not impact their learning and make sure they're healthy and safe. And I might mention we're also all parents, and I think most of us have had children in public schools, and so we're super invested in them.
Oh, sure. 85% of the students across the nation are in public schools. So we appreciate you guys and everyone across the country who stepped up to help get at least those 85% back to school. So the ABC Collaborative is a partnership across states, if I understand that correctly. There's a common purpose. Dr. Benjamin,
Yes.
do you mind elaborating on this network?
Sure. So we started obviously in the state of North Carolina, and by 2020, by August of 21, we had about 50 school districts involved. By August of 2020, we had about 50 school districts involved. By 2021, we had 100 school districts involved, and we started to expand outside the state of North Carolina, ultimately emerging to 9 different states, 100 different school districts, 200 different school districts, and 2 million children served across those school districts. And we just kind of kept the same model of what we would provide would be the medical perspective on things, and we would leave policy decisions to the local entities. We knew even as early as fall of 2020 that we would have risk tolerant communities and risk tolerant school districts and risk averse school districts. And we, America's a big country, and we needed to be able to provide input that leaders of both phenotypes of communities, if you will, could use to fit their community. So while we often had a very, very strong medical opinion about items, we knew that there would be oftentimes community dynamics that would essentially decide the question irrespective of the medical information. And you saw that repeat over and over throughout the pandemic. And the key for us was to just stick to what we knew from medicine, from epidemiology, from science, from rigorous research, and let other folks worry about how that impacted what would happen in the state of Washington or the state of North Carolina or California, Wisconsin, et cetera.
Oh, absolutely. And here in Mount Airy City Schools, we felt like we had to have the board support, the community support, and the staff support, because the families had to send the students back in August of 2020. The board had to vote for it, which they did unanimously, and our staff had to be willing to come in. We followed your toolkit, very, very carefully. We wore masks, we separated, we did everything we could, but we were the first public school district to come back to in-person learning 5 days a week in August of 2020. And we are thankful for you all partnering with us. We're thankful for the General Assembly giving us the money to do Smart Bus, to be able to get the technology to contact trace, because transportation was a huge issue. We're thankful for all the community that chose to send their students back to us. By Christmas, we had almost 85 to 90% of our students back. So to us, that was miraculous. So Dr. McGann, one of the trends in the Voices of Courage is almost every single leader said, build a strong culture early, very similar to what you're describing, and a network of support. And it might be from the medical community, other kinds of expertise, plus educators to get us across that finish line. So I know, Dr. McGann, you did a lot of work directly with the regions. How were you able to build a strong culture and network between the medical community and the education community? I think that can inform future situations where we need to do the same.
Yeah, so it was a really exciting partnership and interaction. Those of us who were meeting with the superintendents, and Danny joined me several times, we would meet every other week to talk about updates on science, what was happening epidemiologically, what was working, what mitigation strategies were working and what weren't. But it was a really terrific environment because the superintendents were talking to one another and sharing what was working for them and how they were implementing strategies. We were able to listen to the superintendents' concerns and issues, to hear from the principals what their issues were on a school level. And really over time, I think there was a lot of mutual trust that was developed amidst these networks. There was a lot of courage, as you note, from Mount Airy and others that demonstrated that they were willing to take the next steps, very cautiously, very methodologically. But I think the trust that developed between the superintendents, the other school leaders, was key. We also wanted to make sure we were available for calls and questions at any time. And we're also happy to present for the leadership, the principal meetings, community sessions. We talked to a lot of Board of Education groups and just tried to provide information and answers. But I think developing that trust over time, learning from one another, sharing what the issues were and trying to address them was key as far as developing that culture.
Oh, sure. And a follow-up, one of your quotes, Dr. Benjamin, was so powerful. We use it a lot. You mentioned that a small group of superintendents in North Carolina, in partnership with the ABC Science Collaborative, changed the world. Here's the quote directly from our conversation. You said, "We knew something no one else knew even before the world knew it. We could safely bring students back to school. They wouldn't allow me to say that school is safer than everyone else at first, but the school district in Western North Carolina, those districts proved it. Those districts were in school and brave enough to open, and they were submitting a lot of data to prove it." Do you mind responding to that?
Sure. So in August of 2020, we had an incredible amount of preliminary data that you could be in a very populated setting and safely interact, provided that you were wearing masks. And we knew that from providing medical care. We already had 4 to 5 months of preliminary data that masking would work. And if I can stick an IV in your arm and do a physical exam and listen to your heart and lungs with stethoscope, I knew in my heart that you can teach algebra. It's going to be okay. So what we did not know at that August of 2020, but we strongly suspected, was that schools would have the culture and the infrastructure to ensure that masking occurred, just like you guys are able to ensure that all the kids get vaccinated or that there's fire safety drills or whatever. And we strongly suspected that. But it was not until late August of 2020 that we had the data in hand. And so in those other weekly phone calls that Kami was talking about, I would ask you guys, those were the ones I primarily attended, and I would ask you guys, how many infections do you have? How many were occurred as a result of being in school? How many of those transpired at school? And the numbers were remarkably low. And in fact, they exceeded our hopes because you guys had done such a thorough job of ensuring masking. You guys were at a level that we were seeing in hospitals, which is hats off to you all. And so as those data rolled in, we had that excitement that researchers get when we know something that nobody else on earth knows. And we knew that you could safely deliver education. We knew that you guys could drive compliance to 95% on your masking. And we knew it was going to change not only medicine, but public health. And the other members on the team would not let me say what I knew, which was actually not only is school safe, you are better off sending your child to Mount Airy Public Schools than going to a Walmart in Surrey County. And the other physicians were not ready to say that just yet, although 3 to 6 months later, they came on board because the data were so overwhelming. And so children and adults who were in the school system were actually safer as a result of being in school, because during the 40 hours a week that they were in school, mask compliance was ensured.
Yeah, absolutely. And our principals were so excited about the same time you were getting excited. They were texting me saying, "We can do this. We can do this." Like a positive case walks in the building and we don't have another positive case for 2 weeks. We can do this. There's no school spread. We went through the first year with absolutely no school spread, zero. We couldn't believe it. And we know that it doesn't matter what size your district district is it's really the percentage, right? We should have had school spread at least 2 to 3%. We didn't have any of that, which meant everybody was also doing a good job, and our community was really buying in. They had to really jump in there and say, we want to be back in school. We don't want to be on quarantine. So to us, it was just amazing. One crisis that we're currently facing as a result of some of this, I've been working with some superintendents from across the country, but we're all seeing mental health needs of children in response to this COVID pandemic. And even though we were able to come back to school, a lot of their parents weren't going back to work. A lot of the daycares weren't open, so they were helping raise their siblings. When we create a network of support to survive and thrive in crisis, how would you recommend current and future leaders to prepare for being a voice of courage in this adolescent mental health crisis? How do we begin to do those first steps of this same kind of network that we're going to need? And we'll let Dr. Benjamin answer first, and then Dr. McGann.
So I think one of the things that legislators, school leaders, physicians, rational human beings respond to, not always, but a lot of times they will respond to, is data and well-constructed data. And so one of the things that ABC brought to the school question was, it's really not how many cases there are, but how many cases occur at school. So if I were to think about any kind of particular problem within a school, whether it is mental health or learning loss, I would first get a very good handle on defining the outcome. The second thing that I would do is find a way to systematically study it so that my peers, wherever they are in the country, can pick up what I've done and replicate it. And to do that in such a way that legislators can look at my data and say, oh, well, I may not have agreed with their initial hypothesis, but the data are sound. And I can respond to those data and make policy decisions based on those data. And you saw the North Carolina legislature do that with the partnership with ABC as it relates to infection. They mandated the reopening of schools in early 2021. You saw that in other school districts throughout the country where, you know, we exploded to 200 different school districts. So first, define the outcome. Second, define a way to look to change that outcome between various groups. And then third, make sure data integrity are robust, because 3, 5, 20 years from now, how people interpret your data will undoubtedly change, but they can always go back to the bedrock, which are your data, and you'll have credibility not only in that question, but in subsequent questions.
Yes, and in the mental health crisis, superintendents have to be cautioned. You can't take on the entire responsibility of mental health. That is not the responsibility of superintendents. It is our responsibility to educate students. But what can we do in our realm of influence within the school day, within the school community, within our outreach to make the mental health crisis better without owning that? And your solution of defining what that success looks like for students that is in our realm of control will be extremely important going forward. Dr.
That's right. Just like we couldn't, you know, we could not help you with how many infections occurred in the movie theater. We could only help you with how many infections occurred at the elementary school.
That's right. You couldn't help that we were a red county, one of the reddest counties in the state the entire time. All we could do was keep the students safe when they were with us.
That's right. And we actually benefited from working with what we don't like to use political affiliation. We like to say risk tolerant communities as it relates to COVID, and risk averse communities as it relates to COVID. Because the risk tolerant communities, they got a lot of things right. And we can leverage those a lot of things that they got right to answer questions that we could not have answered in the risk averse communities. Likewise, the risk averse communities, got a lot of things right as well. Different questions, different aspects of pandemic management, they also got right. And we could leverage their pathway in order to achieve different goals around different questions and to address different medical aspects to inform leaders who were in both types of communities. So rather than bicker about who's right or who's wrong, leverage what I'm doing over here as a risk averse county and what you're doing over there as a risk tolerant county, and let's partner together to exchange data on different questions.
That's right. So we can't control in our county if the risk for mental health issues with our students is very high. What
That's
we
right.
can do is actually have a solution for the students in our school district that will make this a safer place for them to be, and that their mental health could thrive. And so that's the piece that we want to work on going forward. Dr. McGann, do you want to weigh in on the mental health crisis? It's a big one. It's being talked about all over the country.
Yeah, and it's incredibly sad. You know, we are seeing more and more admissions in the hospital because of mental health issues, especially in teenagers. But I do think that, like Danny said, we want to get data, and with data, we can then utilize that to present it to states, federal government, and then get resources. One thing we heard, we started as ABC Science Collaborative meeting with you all, the superintendents, and then one-on-one meetings with districts, with the nurses, social workers, et cetera, to learn more about the mental health crisis and what's going on, and have partnered with you all to create a North Carolina mental health dashboard, with the hope that that will give us the data that we need to really start addressing this mental health crisis and figure out what resources are needed for schools. Especially, as you know, in the Western counties, there's a dearth of professionals, mental health professionals. So our hope is we can help address that. But we're partnering with NC PALS, which is the NC Psychiatry Access Line, and then NC Inc., which is a government group invested in children. So to really, as Danny says, get the data and be able to request resources.
Absolutely. One of the trends that came out of the Voices of Courage is that everybody had to dig deep for their why. What I observed is the why of both the superintendents in our state and the ABC Science Collaborative were strongly driven by a culture that failure was not an option. We had to bring students back to school safely. It seemed to me it was a clear, singular purpose for the students to regain for our initial relationship, and for those students to stay healthy, keep mentally healthy, be able to eat with meals a day, be able to being taken care of at the school. I can see a similar purpose in the current crisis. We have to help students regain their mental health and be successful in their future, being able to be educated. So with the lack of mental health professionals out there, you guys are really good to step in and provide some expertise in this area. You have any advice for us as educators as we begin to work on this vision together, doing this necessary work? Either one of you could answer this one.
Sure. So I think that one of the things that you had with COVID was you had folks who had deep expertise in infectious disease and in epidemiology and in general pediatrics. And because of the nature of the pandemic, we just added on all that additional responsibility for you guys at no charge. And that is not a sustainable, those number of hours is not a sustainable pathway. In order to get a long-term sustainable pathway, you want to distribute those tasks, because most professionals are willing to volunteer a certain number of hours per week to schools. We were doing this 40 and 60 hours a week on top of our typical 60 or 80 hour a week, and they're only 168 hours in a week, right? So So one is to distribute across professionals and to have a deep and broad bench of reasonable professionals. The second thing that I would look at is that there are folks within each of those questions, whether it's mental health or infectious disease, where yes, physicians have some expertise to provide, but other folks who are, say, PhD psychologists or a master of social work who's a licensed certified counselor, those folks can help provide that deep bench outside of just physicians or licensed nurse practitioners or physician's assistants, what have you. And so to go a little bit broader, because there are so few pediatric trained psychiatrists out there.
Dr. McGann, you have anything to add?
No, I agree. I totally agree.
Yeah, we're going to have to do a similar framework, and I think we can learn from what we went through to tap into the expertise around the country and around the state. My presentations to my board and to my public kept talking about, yes, there's a lot of doctors out there, but these are 7 epidemiologists that we speak to every 2 weeks. That was a different conversation when I said, I don't want to listen to these other doctors when I really need to listen to people who've dealt with infectious disease, because this is an infectious disease. Same thing with mental health support, right? We want that mental health expertise to say, while they're in school and when you have a connection with their family, here are things that will help. Here are things that we can do. And educators will need that. But I thank you both for your amazing leadership and vision during the COVID pandemic. We absolutely would not have been in school without the 2 of you and the network that you created. How affirming was it, Dr. Benjamin, that the state law was enacted saying what you had been saying since August of 2020, that it was safer to be in school? I know this is one of your favorite parts of the after story. If you want to share a little bit personally about that.
Sure. So to credit to both sides of the aisle, in 2021, the state of North Carolina voted unanimously in both the House and the Senate, and for obviously the governor, to reopen schools, mandate that they be reopened, full-time access throughout elementary school, and then that was later expanded based on our research to middle and high school, and that those decisions were made based on the research that we had in partnership with the North Carolina school districts. And that partnership was noted in the legislature. And I really think that those policymakers took what the superintendents of North Carolina did in partnership with us on the medical side, and really crafted that legislation. And one of the things that was really nice about it was we were addressing questions that community leaders wanted to see. And so one of the state legislators, who's now at the national level, called me up and was like, Danny, we got to figure out this bus thing, buddy. Can 3 children sit on the same seat or not? And I said, all right, Don, we'll get that into the database, buddy. We'll take care of you. And another state legislator says, look, man, we got to figure out this football thing. And I said, okay, we'll put that into the database. And so it's that iterative, like, this is what I know that as a physician serving in an ICU, it may not seem important Friday night in a small rural community. Having grown up in one, I knew that it was important. But to many physicians, they don't have their hands around that. And one of the things that we were able to do was just to take those questions from the community that were important to the community and say, okay, we'll put those in and we will structure those so that you guys have an answer to the question that's important to you. And that iterative nature, not only in that legislation, but throughout that 2 years, was a really rewarding part of the whole process.
I think that singular vision that was a rallying cry for the General Assembly, the State Superintendents Association with Jack Hoke, the local superintendents in our communities, it really showed that when our students had courage, because they had to come back in a very scary environment, they had courage to come back, do what it was needed. We were able to continue forward with our athletics, with our arts, with our academics, with everything, because we were following the data and making wise decisions and having courage to do that. And I love the fact that the CDC changed their guidance based on a lot of that work. And eventually the WHO did. And we all became singular in our united vision to bring students back to school. Now we have to harness that united vision to make sure that they are mentally well prepared for when they graduate from high school as well. And I think that will be the future crisis that's immediate. But I just thank you guys for your leadership, for your courage, for being part of my network that I could not have done it without. And I want to shine a spotlight on the health community that you all stepped up when a lot of people went home. And we appreciate you and all the medical specialists, our nurses, all the practitioners in our own community, people that contact traced, people that just helped students feel comfortable to come back to school safely. We just couldn't have done it without you. And I want to thank you for being part of our podcast series today.
Thank you.
Thank you. I do have to say we were very impressed by the devotion and dedication of the superintendents to the health and well-being of children and making sure they got back in school and were able to learn. I think the learning lost was less because of what you all did.
Yeah, I think one of the things that impressed us week after week across the country, we initially learned it, of course, with the superintendents from North Carolina, but from across the country, one of the things that we saw over and over again was that we really made initially a good decision to have the superintendent be the primary point of contact, because we had these several very common goals with the superintendents that we had with really very few other groups of people. That is, we had an eye toward public health, right? Every parent wanted their own child to go in safely, but it's a superintendent and an epidemiologist / practicing MD who says, okay, that's cool for one child, but actually we're talking about 80 million children nationally here, okay? The second thing that we had in common was, yes, we want to do this, but we want to do this safely, and we want to, at least until we understand what we're doing, we want to be cautious. And the third thing was, you know, as you've said over and over again, we need to get these kids back into school. And so while we want to be cautious, we don't want to be in this paralysis of analysis. And those three items together, the eye toward public health, safety, and taking action, is a powerful way to proceed forward in times of great uncertainty.
What a great way to end with a leadership lesson that all leaders can take back and use no matter the crisis. Thank you again today. I appreciate you all being on here, and this is powerful work.
Thanks for
Thank
being
you.
part of our shared vision. Awesome.
Thanks.